Good morning. I will walk us through what is basically about 15 slides. Maybe I'll stand because some of you, but I don't. Can you hear me if I'm not right in front of the microphone? Okay, that way you're not blocked there. You all can't hear me? Oh, they're saying yes. Okay, I'll try to make sure I enunciate. So what I'm going to share today is about 15 slides trying to cover the entire Community Health Needs Assessment, which is a 280-page document. We do this in partnership with Public Health and the hospital. Thank you, Dorothy. Thank you. There we go. The IRS requires nonprofit hospitals to conduct a community health needs assessment every 3 years. Public health has a requirement to conduct a community health needs assessment every 4 years. A number of years ago, we decided to reduce the time frame for public health so we could partner with the hospital and work together on this project. It would be silly for us both to be doing community health needs assessment. So we now do one in Dare County every 3 years. It's a comprehensive assessment at looking at the health needs, the health successes, the health gaps. And when I'm talking about health, I'm talking about total health for individuals. So this particular community health needs assessment, we can move to the second slide, is the second of a regional effort. Starting with the previous health assessment that was done 3 years prior, the eastern region of North Carolina said, you know what, let's get together and make this a larger collaborative effort so we can then share data, compare data across Eastern North Carolina as well as the state. We used to only make comparisons between Dare County and what was called like a sister county somewhere across the state that someone selected. And it always didn't necessarily provide the best comparison. So now by doing a regional approach, we're able to make really solid comparisons to what's happening with the health and well-being in Dare County compared to other counties. So there are 33 counties that participate in the regional effort. And when you conduct a community health needs assessment, you first look at primary data and secondary data. Primary data is gathered through surveys, which we collected 1,029 surveys from individuals with a standardized list of questions. These same questions were taken across the entire region. And then we held focus groups. And so we got interviews, personal interviews, and one particular focus group was held with 12 mental health practitioners. So that's the gathering of the primary data. So hearing directly from individuals what they feel are the most pressing health needs in our community and the most successful items that are going on in our community. In addition to health, it also looks at, we look at demographics, we look at the services that are in the community, and we'll go through some of that in these slides. Also, what's collected is secondary data. That's the data that you're pulling from the CDC. It's statistical data. You're looking at health rankings. So that's the quantitative data versus the qualitative data is what you're gathering in your focus groups and your primary data. Once all of that data is compiled, and that's really what mostly comprises the 280 pages of the Community Health Needs Assessment is all of that raw data. Then the Healthy Carolinians of the Outer Banks, and that's a coalition of, many stakeholders. I think we have about 15 members. It's comprised of healthcare providers, the health department, there's community stakeholders. We look and analyze this data and come up with prioritization rankings. And when you're looking at how you prioritize ranking, it's based on what's the greatest identified need, what's the feasibility of being able to address the need, and do we have the adequate resources to be able to do something? Because it's kind of futile to choose that you want to focus on something when you have no resources to be able to achieve that. So that's where we work through the prioritization. Once the prioritization occurs, then we put together action plans, and then we evaluate that and monitor the progress. And the Healthy Carolinians of the Outer Banks, which is chaired by the health representative from the health department, helps kind of keep all of that on track as we move through the process. Next slide, please. So we often like to start out with just acknowledging, and this information comes from the focus groups and the surveys, is that generally Dare County, as hopefully you all agree with me, is a wonderful place to live. We have lots of assets. We certainly have needs, without a doubt, but it is a phenomenal place to live, work, play, raise a family. There's lots of strengths. 56% agree that Dare County is a great place to grow old. 20% disagreed, and I have a slide later to kind of get to what some of the rationale was behind that. 87% said Dare County is a safe place to live. Just over 60% said Dare County has plenty of help for those during times of need. One thing that was noted pretty high this year was the economic impact. Only 35% said that there's plenty of economic opportunity in Dare. And we've seen that with just a number of things, but this really impacts health. For those of us who work in healthcare, we know the social determinants of need, those things like stable housing and employment and your income, can really affect your ability to have the quality healthcare that you need. So these are important things for us to look at and evaluate. Next slide, please. So I mentioned we capture demographic information. The estimated population for Dare County is just over 37,000. We'll highlight from this slide, Dare County is a well-educated community. We compare the education level at Dare County. 94.2% of individuals in Dare County have a high school degree or higher. That's higher than both the state and Eastern region average, which is right around 86 and 87%. 34% have a bachelor's degree or higher. That's also higher than both the state and regional average. And our high school dropout rate is lower than both the state and Eastern region. And as a mom with 2 children in the school system, I feel blessed that Dare County has such a strong school system. And I think that also contributes to health when we're looking at recruiting healthcare providers and staff to work in the field, is knowing we have such a strong school system. Dare County is, I think it's on a different slide. Dare County has a higher veteran population than the state, a little bit lower than the Eastern region. You can see our gender split is 50-50, and then our population statistics are there on the right side. Interesting note at the bottom, 7.5% of residents are Hispanic or of Latino ethnicity. That's an important note for healthcare as well, because for us, certainly at the health department, we have a large percent of our population that is Spanish speaking. So we have to make sure that we have interpreter services as well as our information and English as well as Spanish. So you have to be mindful of your population so you're able to do the appropriate outreach, communication, and assistance. So the next slide identifies the top 5 items that we put on our watch list. This was based on both the primary and secondary data. And as Amy mentioned, over the past 20 years, these items really haven't changed much. They've shifted a little bit, maybe in what's number 1 versus what's number 5. But mental health, access to care, substance abuse, older adults, and cancer have remained our top 5 issues. And Dare County is not really unique. If you look across the, not only the Eastern region, but throughout the state and in the country, these are big items. Again, they may shift in what's 1 and what's 5, but these are often items that are significant in a lot of communities. Out of this watch list, the priorities that were selected for this particular community health needs assessments over this 3-year period were mental health and substance abuse. And as Amy mentioned, we had the Access to Healthcare Task Force intact, but the last meeting was a month before the pandemic hit, and it's just all of us were just taxed for time of where our time was being allocated. The next slide, and just so you know, this PowerPoint for the committee, if I can't remember, oh, you all do have it. That's right, you have a copy, but if you all want a copy, we will put this on our website as well. This presentation, so you don't have to read the whole 280-page document. Right now, the 280-page document is on the website, but we'll also add this PowerPoint, because I know from your seats it's hard to see. This chart is showing you the rates of causes of death in Dare County over different 4-year increments. And I think the big thing to just point out on this slide, cancer is number 1 across that as far as the rate for causes of death. But there hasn't been a significant difference over this time span either. And this time span, for those of you, it might be hard to see, is from 2012 all the way up to the most recent data, 2019, but it's in 4-year increments. There's been some drop. I mean, overall, the decrease in pneumonia and influenza deaths, that's probably the most thing that you could say is statistically significant. But it's just been some fluctuation here and there. And the other thing that's a little bit hard with this too, when you're looking at the big gap in time, is the 4 years also cover each other. So, the first period of time is 12 to 16, then it's 13 to 17, so it still covers some of the previous time. It's really hard in a 3-year period of time or a 4-year period of time to move the needle tremendously on a health outcome measure. But I think the overall, these are the items that we continue to watch, that we continue to build our support services around in our community. So we'll take a deeper dive into a few of these, with the next slide being mental health. One of the things undoubtedly with the pandemic, and there's a COVID slide later, that was identified in focus groups, is the impact on mental health with COVID, significantly with depression and anxiety, spanning across all ages. Overall, since the last community health needs assessment, there was a 3.14% rate decrease in death by suicide. Though Dare County remains, for Dare County adults, suicide is still the 8th leading cause of death, and that's higher than North Carolina. So the rate for Dare County is 19.3. The rate for North Carolina is 13.4. That is something that the Breaking Through Task Force, they actually have an initiative going on this month. They have a documentary on suicide. They've been able to connect with families who have been impacted by this and put a really powerful documentary together. So this is something that's specifically being targeted now to be addressed by that task force. The emergency or EMS, emergency medical service visits for mental health, in 2020, they increased to 4.9% over 2019, which was 3.6%. We've had an increase in the calls to mobile crisis. This is a 24-hour service to help those in need. There was a 41.17% increase between 19 and 20 in children's mental health calls, so families or individuals calling for support, and a 216% increase in calls for individuals 19 to 25. So certainly, those are alarming statistics, and it just points to the need of what a critical service the mobile crisis service is. Again, it's a 24-hour service. Yes? You did. It's not good. 41% increase in children's mental health calls to the mobile crisis line, and a 216% increase in calls for individuals ages 25 to 40, or excuse me, 19 to 25. Yep. A 47.1% increase in emergency department visits for behavioral and mental health needs for children during this period. 307 is the average visits per year for behavioral health concerns, and that was between the time frame of 2017 to 2021. Moving on to substance abuse. And I will say, we have one thing that's really tough in public health, speaking for public health. Well, first off, we have an amazing Saving Lives Task Force. It's chaired by Commissioner Wally Overman and Roxana Ballinger, and just a really dedicated group of substance abuse professionals that serve on that committee. One of the things that's really tough in public health is how you measure what would be happening if you weren't doing the work you were doing. And so, when we see these statistics, and they're not pleasant, they're not pretty, and it still speaks to why so much work is still needed. But it scares me to think what would be happening if we didn't have these amazing dedicated professionals doing what they're doing, because we have increased resources for individuals in Dare County over the last 5 to 7 years for mental health needs. But when you still see numbers like this, it's alarming. But it doesn't say that what we're doing is not working. This is just a monumental issue that we have been battling as a country for years and years and years, and of epidemic proportion and generational. And so you're fighting a constant uphill battle, but you don't give up because you are making a difference. So moving on to substance abuse. The rate of unintentional medication and drug overdoses is higher. That's 24.5% than the state average of 16.7%. It's also higher than the state average is the rate of unintentional opioid deaths, 21.7 as compared to 13.6. The EMS visits for substance abuse also increased, as did the mental health I showed on the previous slide. Not as significant as mental health, but in 2019, 4.3, 2020, 4.4. But sometimes it might be classified as a mental health, and also it's often very much co-occurring. So maybe the first classification is mental health, the second classification is substance abuse. So it gets classified in one, but very often they're hand in hand. So 42% of those who responded to the community survey identified substance abuse, misuse, and as a health behavior residents needed more information about. So that's something that's certainly on the task force agenda as well, of continuing to get information out. Oftentimes, individuals, you can't think you just say something once and it clicks, whether it's where to get help or what the problem is or where the resources are. It's they need the message when they need it. And that might not be when the next person or the other person needs it. So that's just a big challenge in this communication realm, which is why there's still so much work to be done. The next slide is looking at access to healthcare services. So this certainly is something for this task force, some really relevant data here. I'll draw your attention to the bottom chart, and I'll go through that because I know you all probably can't see that in the audience. So this looks at some of the different genres of healthcare and looks at our provider to resident ratio. And so for mental health, there has been improvement between 2018 and 2021, but we're still significantly less providers per resident than the state average. So while we improved from 640 to 610, meaning there's one provider for every 640 residents. At the time of the assessment, there's one to every 610, so that's an improvement. But the state is 1 to 390, so we're off significantly from that. Primary care, we also saw improvement, 1 to 1,700, now improved to 1 to 1,600. The state is 1 to 1,400. Again, one provider for 1,400 residents. Non-physician primary care, so your mid-level practitioners, we are 1 to 1,280, whereas in North Carolina it's 1 to 750. Dentist, it's the one area by paper that we are higher. And I say by paper because this is based on where your physician is registered with their certifying board or agency. So if a dentist still maintains his license and lives in Dare County and is registered, that counts in this figure, even if he or she are not practicing currently. So we're 1 at 1,480 as compared to 1 for 1,720 in the state. But these figures make sense. I mean, we want to improve on them, but they make sense because we're in a rural area. We're being compared by the state, which factors in Raleigh and Mecklenburg and Greenville, and where you have medical centers and, big health systems in those communities as well. So also of note on this side is 15% of the population, 0 to 64, are uninsured. So certainly when you're looking at what the work of public health and the community health, in our free and charitable clinic, and certainly charity care that happens with the hospital, that's an important metric. And the rate of individuals with health insurance has decreased since the last assessment by 2.18%. The next slide is a picture of our older adult population, and this is important. We've known for many years that Dare County has an aging population. And the first two percentages up there really speak to that. 31.3% of our population is between the ages of 45 and 64. That's higher than both the state and the regional average. The state is 26% and the regional average is 25%. And our population 65 and over is 20.7%. Again, much higher than the region and the state. The state at 15%, or 15.8, and the region at 15.7. The one shining star, I would say, is our percent of those individuals 65 and over living in poverty. Fortunately, we are much lower than the state at 2.9%, whereas the state is 9.1% and the region is 10.3%. The leading causes of death, vary again slightly in order based on the specific subset, whether it's 65 to 84 or 85 and over, but they're within the same 10 that we showed on the original slide there. So. Moving on to the next slide is just an overview of our cancer data. There are 3 cancers where we're lower than the state average. That's breast cancer, prostate cancer, and colorectal cancer. Other than that, our other averages are a little bit higher than the state average, with the exception, when I say a little bit, of the oral cavity and pharynx cancer. That's pretty significant at 16.3% compared to North Carolina at 6.7%. So I don't know if we have any dentists in the room, but that's something that needs a little bit more delving into to understand that variance. Why is that so significant? All cancer incident in Dare County has decreased by 4.73%. Certainly, we have a lot more resources for individuals with cancer in recent years than we had, say, 7 to 10 years ago, with the work at the hospital and with patient or cancer navigators, and really trying to help connect people to the services that they need. The next slide is a highlight of just the COVID-19 pandemic, which personally I'll have to say, don't really even want to talk about, but just a couple of things there I'll point out from the data from the community survey that I thought was nice. 84% of individuals said it was easy to avoid getting sick. So despite all this going on, I think that is partly connected to the next one, where 89.9% of people said it was easy to get information on how to protect yourself. So getting that information out about what you should do, how you should do it, what measures you can take. Certainly, I think it also correlates to the high vaccination rate in Dare County. Dare County was second in the state for the highest percent of individuals vaccinated, with 70% of the population being fully vaccinated. This was back when the data was collected, and 74% of the population having at least their initial dose. The next slide is a snapshot of some of the data related to the economy. Yes, sir. Thank you. Thank you. Thank you. Thank you. For the economy, the median household income, just over $59,000. 9% of those living in Dare County, are living in poverty. 15% of which are children. And I already indicated on an earlier slide, 2.9% are individuals ages 65 and over. 7% of households in Dare County had SNAP benefits. That's basically food and nutrition supplemental benefit in the last year. The top 5 employers by size in Dare County Schools, Dare County, Vidant Medical Center, Food Lion, and NC Department of Transportation. And we see that some of our greatest population bases of poverty are in some of, Manteo and Wanchese, Buxton, and then Hatteras Village at the largest percent. So some of our most rural areas of the county. And that really concludes the summary. Again, there's way more information in the 280-page document. We will post this within the next 24 hours if you're looking for this snapshot. It's darrenc.com, and then you click on the Health and Human Services and Publications. Dorothy, is that probably the best way to direct? A link on the... Wonderful. Okay, so Dorothy's going to work some magic and put a link on the Dare County homepage to make it really easy to find. Thank you.